Actually, can I ask you, what do you see when I do this? Are you still seeing the slideshow?
Yeah, it's still stuff in slideshow.
Okay.
Oh, now it's switched over. Okay. Good.
Still see the slideshow?
I saw it disappear for a second. So whatever you did worked.
Yeah. Yeah, for some reason there's multiple applications up right now for my PowerPoint for this. Which Cliff. Are you seeing the right thing or no?
Yeah, it's switched over, yeah, to presentation.
It's good?
Yeah. But it's back to showing the next slide. So go to display settings and do that.
Yep. Okay.
Cool. And then press home.
Is it good again?
Yeah.
All right, well, then I'm gonna mute myself and I'll wait for you to turn it over to me. Thanks, Abu.
Yeah. Hello, everyone. For those who joined us, thank you, and we will be starting in a few minutes. Just waiting to try to wait for other people to log on. Thank you for your patience. Hello, everyone. Thank you for waiting. We're still waiting on like a minute or two to see if other people join. But in the meantime, can those who have joined tell us a little bit about yourselves, like your name and what Urban Indian Health Program or organization you represent? Again, for those who have joined, if you could possibly provide us with your name and what Indian Urban Health Program or organization you represent before we get started, that would be great. For those who are on the line, can you hear us? And are you able to hear us? Um,
Yes, I can hear you. They may need to unmute their mic. When I joined, I was muted.
okay, if you, Jess and Laura, if you could unmute your mics just to let us know you're able to hear us, that would be much appreciated. Okay, you're muted.
Can you hear me okay?
No, yeah, I can hear you now. Thank you for letting us know you're here. Okay, without any further ado, I know people might still be joining, but let's take
Muted. Unmuted.
before to get everything started, I want to welcome everyone that joined us today. My name is Sebu Kuyumjian. I am the Public Health Associate in the Technical Assistance and Research Center at the National Council of Urban Indian Health. I want to welcome everyone to our Behavioral Health Community of Learning series on best practices on grant writing, and to give everyone a brief recap recap of our first community learning. We discussed best practices on planning for data collection, learning different culturally relevant models, going over basics to develop evaluation plans, reviewing common evaluation methods, and learning how to select appropriate evaluation tools, and given different resources in developing data evaluation plans.
You need this one?
And today, in part 2 of our 3-part series, we will focus on how to successfully respond to a project narrative. Again, my name is Sevu Kuyumchan, and I am the public health associate.
Thank you.
For those who are, if there's noise in the background, please mute your lines until there's time for discussion. So to continue on, our overall guide at NUCUI in regards to community learning model, it's based on the knowledge that you as a UHIP staff or organizational staff are able to bring your best practices and successes to the table in assisting other peer UHIP staffs. Therefore, we invite you to provide feedback and share as you feel, so that we can all grow and learn from one another. Today, I would like to share with you briefly some important best practices before opening up to comments and questions later on. This community learning will not be covering all steps in the grant writing process, but we will try to highlight areas that seem to be most challenging when shaping a funding request. Although there are many steps, many types of funders, such as foundations, corporations, federal agencies, almost all require similar information, even if the length or the formatting varies for proposal submissions. So, as I mentioned, we will be covering the topic of how to successfully respond to a project narrative in regards to behavioral health and related grants. And I would guess that many of you know and possibly utilize the checklist when trying to respond to a grant's project narrative. But it's really significant to have a well thought out project checklist and understand the steps in developing your checklist to address the grant's needs. Whether it's for a suicide prevention program on a college campus or implementing integrative care at a residential treatment program. There are always there should always be a well thought out checklist, and without it, or a well written one in some cases, your proposal will more likely fail to meet passing grading standards. So before I go ahead and introduce today's presenter, I want to, can we switch slides possibly? I want to share with you a little bit about the Technical Assistance and Research Center. We're here to support and develop, in regards to developing quality and accessible, culturally sustainable health programs for American Indian and Alaskan Natives living in urban support areas. And we do this in a 4-level model. This is through information dissemination, whether it's providing certain policy changes or different requirements in regards to a grant that occurs that might be supportive and helpful for UHIP. This also could mean providing tools and training, such as webinars and community learning such as these, or in-person expertise coordination to get people to the next step in their UHIP capacity building. And then also providing one-on-one technical assistance support amongst our staff members, and also doing research and evaluation. As some UHIPs don't have the capacity to evaluate and measure the effectiveness of community readiness and other aspects of their UHIP. So we're here to support each and every one of you. Can we move to the next slide? So a couple of just things to look forward to in the future. In the near future is that we will be sending out a calendar invite in the next day or so. The next day for our next community learning that's happening on March 6th, and it's going to be focused on grant budget preparation fundamentals. So people look out for that after this community learning. Can we switch to the next slide? So without any further ado, I want to present our presenter, Jamie Ishkamer, and a little background on her. So Ms. Ishkamer is the Deputy Director at Nikui. She's a member of the Choctaw Nation of Oklahoma and has extensive experience serving Indian country at the regional and national level. Before joining Nikui, Ms. Ishkamer had the honor of working at the California Rural Indian Health Board, the National Indian Health Board, where she provided training and assistance for tribal health infrastructure development. More recently, she was a senior analyst at the Association of State and Territorial Officials, where she supported state and territorial public health infrastructure development through quality improvement lens. Ms. Ishkamer also has successfully submitted grant proposals and received grant funding from the Center of Disease Control, Indian Health Services, and the Robert Wood Johnson Foundation. Ms. Ishkamer is passionate about transdisciplinary problem solving of systems and performance improvement, and she graduated from the University of Washington, University in St. Louis, with her master's in public health and social work. And now I'm going to hand off the mic to our presenter.
Thank you, Sabu, and thank you all for giving me the opportunity to present today, as Sabu mentioned. My name is Jamie Ishcomer, and I am the Deputy Director of the National Council of Urban Indian Health, as well as a member of the Choctaw Nation of Oklahoma. And here we are discussing how to successfully respond to a project narrative for behavioral health and health-related grant programs. And so with that, I would like to first hear from folks on the line. I know there was kind of crickets going when Sabu asked if folks wouldn't mind sharing who's on the line, but I hope that doesn't continue, because I really want to have a great discussion today, hoping to have it be interactive and work together to develop a checklist for appropriately responding to project narratives. And so I think lines have been unmuted, so if you want to go ahead and unmute your line and share what do you find most challenging about project narratives and grant proposals from your end, just so I can make sure that I touch on that. And I will share a little bit too. I have my slideshow, but I want this to be most impactful to what your needs are, and so it'd be really helpful if you all want to share a little bit about that and what you're hoping to really get out of this today. Can I ask anyone on the line would be willing to share? Anybody? And I want to make sure that I'm as helpful to you all as I can. So if something does come up throughout this throughout this presentation, I do ask you all just to please feel free to keep your lines unmuted unless you're doing other unless you have some background noise, and feel free to ask questions throughout this conversation. I believe Sabu is monitoring the chat box too, so if you'd prefer to communicate that way, if you have questions for me, please feel free to submit them that way as well. And Sabu, if you wouldn't mind sharing those.
Yeah, no problem. I definitely will. Please, whoever would like to present any or ask any questions, and you're kind of shy or don't have the space to do it, just put it in the chat box, and I'll definitely relay that information to Jamie.
Thank you. All right, so I'm going to ask one last time. Does anybody want to share kind of what they find most challenging about responding to project narratives or grant proposals?
I'd like to share one challenge about responding. One of the biggest challenges when you have a lengthy funding opportunity announcement is making sure that you've addressed everything that's asked for in the funding proposal. So how do you keep track of really a complicated narrative where there's a variety of tasks that you have to respond to when you're pursuing funding? And are there some recommended strategies for how to do that well? And of course, being mindful of page limits and things like that when you respond to a grant proposal.
Yes, great. I'm so glad that you brought that up, because that's actually what we're going to be really working on today, hopefully as a group, actually developing a tool that we can all use to better keep track of all the components that are required in grants, the project narrative, and a way to keep track of all of that, and also to support some internal planning around that. Thank you. Anybody else on the line have any challenges they would like to share? All right, so I'll go ahead and move on a little bit then, but we will definitely get to some tools and strategies to ensure that you're checking off the box of everything that you need to respond to. And I am hearing some echoing and background noise. I don't know if folks wouldn't mind muting their phones until they're speaking. That would be hugely helpful. Thank you.
We have Janelle from the Native Lifelines in Boston on the chat. She just introduced herself. Hi, Janelle.
Hello.
Hi, Janelle. Welcome.
Hi, thank you. Can you hear me?
I can, yes.
Okay, I thought I put mine on mute. That's why I didn't say nothing to introduce myself. I'm like, can they hear me?
No, we can hear you loud and clear. Thank you for joining.
Oh, you're welcome. Not a problem.
Yeah, and Janelle, would you mind sharing if you have any particular challenges that you're really hoping to hear some information or strategies around today?
I'm for myself as a program manager and working at a different urban site and dealing like with grant writing. I just want to learn about information on how to actually, by just listening to everyone.
Great.
Learning different strategies.
Perfect. We'll definitely go through a few of those and also some resources along as well.
Thank you. I appreciate it.
Yeah. All right. I'm going to go ahead and move on. So a few keys to success, at least, and I'll share that this is just purely my strategy that I take when I'm developing a grant. And it's what I found that works best for me. It may not work best for you. And so I also want to welcome you all to share what resources and tools and strategies you have as well. Again, being a community of learning, I hope that we can all learn from one another. So these are kind of the four big steps that I take, however, when I'm responding to a project narrative. So first, I review the entire announcement. Then I identify all of the requirements, looking at all of the musts or required or have to have. This is where I get into kind of the tools that I use. I develop a really robust checklist with all of the requirements for the grants in there. And that really gets at what the previous person mentioned, like if it is a lengthy announcement and there's a lot of things that need to be included in the project narrative, this is a really great tool for making sure that you have everything in there that you need. And then finally, another tool that I really use is to develop an internal work plan planning document. And that's more for identifying who is going to actually be completing the components that go into the narrative. It's a helpful tool to plan both the activities as well as internal planning for the work and who's going to accomplish that. So first step I shared is I review the entire funding announcement first to ensure it's a good fit, and then also to determine, what are the components I need in there. So look at the eligibility requirements. Look at, is there a lead organization? Is there a requirement to partner or or collaborate with others? Those might be, you might have to need an MOU in place or letters of support to demonstrate that. I also look through kind of the activity and strategy requirements. One thing that often is in many grants right now, especially federal agencies, use of evidence-based practices, and so pulling those pieces out, kind of the requirements within the activities and strategies within the individual grant. Looking at organizational capacity, for example, and do you have data to demonstrate your capacity in this area? And also what community readiness and need to ensure that you and have data to demonstrate this, to ensure that you're addressing the true problem in the community with based on the data, but data drive the decision in that. One other thing to really keep in mind when you're reviewing the entire grant application is the matching or in-kind required. I think that this is one that oftentimes gets looked over, and you maybe not realize until you spend a few days working on a grant and realize, oh no, there might be matching or in-kind requirements, and how does that play a role in my internal planning of all of this? And so just put that in there to keep that in mind as you're developing these and what options and what you might be able to support in kind from your organization. So I already mentioned kind of the second piece of it. And this is to further identify, this supports you in reviewing the entire application as well as further identifying all of the requirements. And so this is the next step that I take to identify all requirements, and I'm going to walk through this with folks. So I do have here, and please let me know if you're not able to see my screen. I do have here the Department of Health and Human Services, or HHS, SAMHSA's Garrett Lee Smith State tribal youth suicide program and early intervention grant program. Can folks see that on the screen?
Yes.
Okay, great. So, like I said, the first thing that I do is do the find and replace. So I want to find must, because these are everything that must be included in the grant application. You just put find what must, replace with must, and then you can also replace the format and do highlight. And then just simply click replace all, and you see that there's 171 instances where must is written into this grant application. And so what this is going to do is go ahead and just highlight all of those instances, so you can see that on the screen here. Some other keywords that I like to do this with are, require. And each grant application may be different in the words that they use. So you can see here, require was mentioned 185 times. Required is another one that I typically go through, and this one was 71 times. And so that's why it's important to first kind of read through the entire application and make note of some of these keywords that you need to include in the application. I'm seeing requirement in there too, so I'm just going to replace all of those. All right, so can I ask any questions so far about this step? Okay. Great, so I'm just going to quickly scroll this, and you can see where all of those, the must, the required activities, requirements, and that is just a really great thing to do, just again, initially to see, okay, how many pieces need to go into this? What all is a requirement? What has some flexibility? And it's a really great tool. Just simply do the replace, and it highlights it for you. Switching back to the presentation. Okay, so then I'm going to be switching back and forth, so please let me know if there's a delay in anything, or if you're not seeing what you believe is the appropriate screen. Okay, so next up from that is to develop a proposal checklist for internal planning. And so this is, again, why it's so important, or for me personally, to go through and highlight all of the musts, the requirements, because then that really informs what I think is the most important tool that I use in my narrative, responding to project narrative proposals. And this is developing my proposal checklist for internal planning purposes. And so with that, you include all required information, the font, including the font size, section headings, page lengths, attachments that may be included. You also include information to support the proposal development, such as action items that may be necessary, or responsible parties and parties or party for that. And so what I'm going to do now is get out of PowerPoint again and walk through this actual grant application, as well as this checklist that I began to develop, and I'm hoping that folks on the line would be willing to help me out with it as well. Okay. I'm hoping this won't be too small for folks, but trying to get both of the critical things here that you want. So, and this is the beginning of how I typically develop my project proposal checklist. And so the purpose is to, again, really to provide an opportunity to fully review the application by breaking it into manageable pieces. And so I know that was something mentioned of a challenge that somebody mentioned, is how to keep track of everything when there's so much to do. There's various sections, and you have to do data, you have to do the evaluation piece, how you're going to, what your activities and strategies are. And so this, again, really breaks it down into manageable pieces. Second, it acts as a project management tool to help delegate responsibility for this. So you can see here the responsible party. I think, oftentimes oftentimes grants tend to fall on one person just because there's not a kind of thoughtful planning that comes into this. But I feel like if I'm using this this checklist where I have each of these areas as one separate box, and with the ability to have different individuals responsible for those, it helps to really think through who in your organization has the knowledge and skills to help develop this piece of the application. Who might have that data that is critical to that piece of it. And then I also include, of course, and then so this also acts as a checklist, of course, to ensure that you're not missing any components of the application. And so as you can see here, there's kind of a document title, the section title, and then the scoring component of it. The requirements within the document. And so like I said, I like to break, I know it might seem very time intensive and kind of nitpicky, but just, it breaks it up into these manageable pieces, and it allows you to check off every single box so that you know that you're capturing everything that's required within the grant. The page length, and this is what I use for to check off each box when that is complete and ready to go. So the page length, and again, that kind of helps you plan out the project as a whole. So we can see here I'm going to be using the Garrett Lee Smith proposal, as I mentioned. And so their grant, the entire project narrative can only be 10 pages. And so from here we have to break down, okay, section A is the population of focus statement. And I know from the grant application, they said approximately 1 page. Section B is the implementation approach, and they list, it should be 5 pages. And so I know right there, at least with those 2 sections, I have a little over half of my project narrative done. However, of course, you need to be mindful of any appendices that you may need to attach, or other attachments that you can include, such as a work plan, if it's included in the page limit or not included in the page limit, all things to pay attention to as you're developing this. And so I also find that it's really helpful to include additional information. So kind of the bigger piece of this section B is describe the goals and measurable objectives. If you're using this kind of as a project management tool and wanting to build the capacity potentially of other individuals in your agency that aren't as familiar with grant writing or developing goals and measurable objectives, providing this extra little bit of additional information to help support them in developing this also goes a really long way in giving them all the information that they need. And again, I think it's always important to try to spread the wealth of grant writing, and we all know that how lengthy that process is, and so to share that, and also again to build up other folks in your agency that can maybe support this work as well. And so with that, I'm not going to fill out all of this, but I want to just quickly walk through the actual grant project, the actual narrative, and let me get through to pieces that we want. And again, you can see here all of the musts and requirements and required. And so this is the section that we're really going to use for the purposes of this checklist, is the application submission information. I'm not going to get into the budget information for this presentation because, as Sabu mentioned earlier today, there's a presentation on that next month. And so I'll touch on it a little bit, but not going to get into the details. But then you see we get down to the project narrative and supporting documentation. You can see all of the attachments that are required. These are all important pieces to put in there as we develop that, and that's something that I typically do towards the end. But right now, really just wanting to get to the actual project narrative. So here we have section A. And before I do that, I actually want to say, so in looking at all these musts and requirements, so you must use the 5 section headings listed below in developing your project narrative. You must indicate the section letter and number in your response. And so you can see here that I included that in the project narrative also. Use exact headings, section letter, and section number for each section. See below. So I included that information right here. These are the sections, the headings that correspond with this. All of this information, I know it might seem a little redundant to have to go through and maybe just copy and paste the information over here, but again, this is a tool so that you can physically check off and make what this is a 85, you can see an 85-page announcement into hopefully 1 or 2 pages of the checklist. Hopefully you can really make it manageable. And so in just walking through this a little bit, you can see for section A, I have what you must do, and to demonstrate the population of focus and statement of need is identify your populations of focus and the geographic catchment area where services will be delivered. And so that's something critical to include in this, of course. And so once you have developed that, you can just mark the X on there once you have that. And I'm going to get into a little bit of the data here in a little bit too of how to better inform these pieces of the proposal, but just for the checklist purposes, just walking through them right here. The second piece of this, describe the extent of the problem in the catchment area. So again, this is just number 2, but as you can see here on the other side of my other screen, I actually broke that into a number of smaller pieces, again, to really make it manageable and check off each one of those components. So describe the extent of the problem, describe the gaps in service, describe the extent of need, so prevalence rates, incidence data rates, for example, and then, of course, identify the source of data used for that. And so that's taking this information right here and making it more manageable into this checklist. And you can see here that for section A, it's 10 points and approximately 1 page. So I just want to quickly pause and see if anyone on the line has any questions or any points of clarification needed at this point. All right. Hearing none, I'm going to go ahead and continue on. And here is, so this is where I stopped in hopes that, we can spend a little bit of time developing this together. So section B is the proposed implementation approach. So it's 30 points, approximately 5 pages in length. So here, the first one is describe goals and measurable objectives of the proposed project. So what's nice about this about this funding announcement particularly is they have the information of where to go to get additional information. So if you just control, click that, it'll bring you down to how to develop goals and measurable objectives. So this is actually the same exact information that I pulled into the additional information. And so if folks are new to grant writing or maybe aren't as familiar with the difference between goals, objectives, and outcomes, essentially, this is helpful information for them to share, or for them to have. You can, of course, include with this specific grant application, they include some examples of that can be really helpful too. And so, again, that's why it's important, why I always read through the entire grant application first to also then identify kind of what are some of these tools that the funder provides as well. All right, going back to that section. What else do we see in here? So describe the goals and measurable objectives from Appendix E. So we had those characteristics of effective goals in this additional information box of the proposed project and align them with the statement of need in A2. And so here, what I put in here is must be aligned with statement of need in A2. And so that's telling me that it's referring back to this this section, so A2, describe the extent of the problem in the catchment area, including service gaps, document the extent of the need. And so this now is linked with this. And what then I like to do once in a future, it's mentioned in a different section, then I go back and include that in the previous section. The statement of need must be aligned with information shared in section B. So again, I know it might seem like it's getting very into the details and nitty-gritty, but I think it's, again, a really, really great tool to make sure that you're capturing all of that information. State the unduplicated number of individuals you propose to serve annually and over the entire project period. And so that would just be one other thing that you add in here. And again, you can just simply copy and paste it and continue to build your checklist in this way. Okay, any questions at this point? Okay. So I'm not going to spend too much more time going through this. This will be fully developed, and I don't know if any folks are planning to apply for this year at Lee Smith grant, but please feel free to definitely use this as a checklist to do so. That will be sent out with the slideshow as well as some other resources too. And do I have any questions about kind of this checklist right now? All right. And as I mentioned, go ahead.
Or feedback. So, like, is this helpful for people on the line? Do you feel like this is a more effective way to address a project narrative?
Has anybody used something similar, something different that they think is more effective? All right. Just to continue on, you can see, so section B is again all about the proposed implementation and approach. And so describe how you'll implement the required activities. So that's a big thing with this grant proposal specifically, is that they have specific required activities that you must include. And so that's a big thing again to look at. Read the entire grant application first to ensure that you're eligible and that it fits with what your community's needs are. And then again, this can be used. You also can add attachments that are needed, anything like that. I actually do want to quickly pull up. I'm going to stop sharing my screen quickly and pull up a completed one just so that you all can see what that looks like when it's fully developed, kind of the extent and how much information does go in there. And this was for a Centers for Disease Control and Prevention grant. And if anyone has any tips or tools or information or other strategies that they've used, I would love to hear them. Going back to sharing my screen quickly.
Hi, Jamie.
Yes.
This is Kimberly. I really appreciated the spreadsheet that you showed and the way that you broke down all of the different components of the project narrative. I think also, if there's a team working on writing the grant too, even adding an additional column so that you know who is responsible for which portion of that might help in this spreadsheet too as well. Just so that the person that's managing it kind of keeps that in mind. And I don't know if dates need to be in or not, but yes.
Yep. Oh, so that is great. That's a great thing to ask, Kimberly. Yeah. So I did have responsible party, so who's the lead on that, but I don't have dates in there. So that's definitely an improvement. I'm going to go ahead and add that right now. Great, and thank you again. All right, so here is a completed checklist that's been developed. And you can see this is, again, a CDC application, or a CDC grant. And this one had project abstract, project narrative, so everything that needs to go into there is succinct and self-explanatory. Has the naming conventions in there, so you can use different colors of font to really to get out, you know, the logistics pieces or those types of information that are necessarily included, and it's something that you can change to it. So that's a must, a requirement that you cannot change. Get into the project narrative. I title it, including the title, includes relevant background information, get into the approach. And like I said, I break it down to each individual section. So 2 to 3 sentences total, how the application will address the health problem. So again, this is just more of a completed project checklist. So again, I'd love to hear if there's, so we've already added the deadline column to it. Can anybody think of any other piece that might be important to add? Okay. Well, I'm going to go ahead and get back to the slideshow then. And so again, on the grant checklist, I include all information again, even as minuscule as it may seem, you know, the font size, the font type, the section headings, the page lengths, attachments. And then also include information to support the proposal development. And so I did have in there action items, the responsible party or parties, and now I'm going to have to add the deadline in there too. Thanks again, Kimberly, for that. All right, so any questions on that piece? All right, that was the longest portion of this. And then next is an internal work plan, or internal work plan for planning documents. And so this is also, it kind of is gets at the deadline piece, Kimberly, that you had mentioned a little bit, and this is also more for internal planning. And so it's use the guidelines within the announcement to ensure that you're capturing, you know, all of the necessary information. So the goals, objectives, activities, strategies, outcomes, include information to support other portions of the application, including, you know, organizational experience, existing resources, budget implications. And to support some of these, for budgetary implications, think about, you know, staff time, existing staff, new staff. How much staff time does it take to plan the project, to implement the project, to evaluate the project, to report the findings to the project? Think about all of those tiny components that go into it. What supplies or equipment may you need? Think about, you know, maybe computers, software. You can think much broadly than just the typical, you know, office supplies that we typically tend to think of. Is any travel required? Make sure to include that in there, as well as consultants. If you're going to use an external or an outsource this to maybe a consultant or another subject matter expert. I didn't want to get into a lot of this because, again, I know that this is going to be discussed during March 6th, and so I encourage you all, if you want to learn more about preparing budgets for grant proposals and grant narratives, I definitely would encourage you to attend that session where Alejandro will get much more into the nitty-gritty of that. And this is just an example of an internal working document that I developed. This was was developed for that CDC grant checklist that I had just shown you. And so you can see kind of this, all of the items in red. These were the only things that were actually required on the grant, on the work plan itself. It asked for the objective, and that was, you had to identify that from the Notice of Funding award. And so that's similar to the SAMHSA grant in that the activities were predetermined and you needed to use one of their activities. And so then the activity, the process measure, the responsible position or party, the completion date, and the estimated cost. So again, those things highlighted in red are the only things that are actually required of, or were a requirement of the application. However, this is again an internal work plan planning document to help you think through all of those different components. And so the activity, who's the target audience? Is it youth? Is it elders? Is it, and again, thinking about the target audience for this, the Garrett Lee Smith is youth within a certain geographic location or area. What are the actual deliverables that you're wanting to get from this, the tangible pieces, the tangible outcomes of it? What inputs will this take? Again, think about staff time, materials, equipment. Know what the organization already has, so that's getting into organizational capacity, and what they might need so that you can think through and to support the budget a little bit more and just the infrastructure needs. The outputs required to accomplish this. I mean, do you need to go out into the community and gather information, and what do you need to do to accomplish this? The organizational experiences and available resources connected to that specific activity. You know, have you, if this is a teen suicide prevention grant, have you been doing teen suicide prevention for 15 years, and you that can be as an individual or as a team. So as a organization, you have 25 years providing behavioral health and substance use treatment or prevention services, for example. And then again, the process measure and the responsible party, those are all things that were a requirement of this grant. Include the start date, and this is more for the work plan planning for down the road as well, the completion date, budgetary implications, which I mentioned earlier, and then the estimated cost for each of those. So the budgetary implications can help us determine the estimated cost per activity. And this is another tool that I really like to use, and this will be shared as well. But I want to ask if folks have any questions about this, or if they think there's anything that maybe is missing, or do you have a different strategy that might be more useful than this?
What are your thoughts on this process? Like, is this helpful? Is there a clear, more effective way than what has been used before in your organizations? Just your thoughts, I think, also is like, if you have comments about this entire process.
Yes, please, if you have any questions, or yeah, if there's, is this a similar process that you all take? All right, like I said, this will be also included in when we send out other resources, including that checklist and this internal work plan planning document, just so you can have it. And each grant will be a little bit different in what's required of it. So, you know, you'll have to tweak it a little bit, but again, I think it's really helpful to include, or to always have the red pieces, or some way to note what is an actual requirement of the proposal versus what's just helpful in your own brainstorming and planning purposes. I mentioned earlier that I would touch on getting to the data to demonstrate need. And so there are two ways that you can, two sources of data. Internal data, so maybe your health records or data from these projects that you can use, as well as external data. And these are some of the typical sources of data that I use. The Indian Health Service, of course, SAMHSA, given this is a SAMHSA grant. The Tribal Epidemiology Centers oftentimes have a lot of great data, understanding that with all of these, knowing that it may not be specific to your population, but you just have to denote that in some way that you use the data from maybe a regional level because the data at your level is not available, but if you do that, I would really encourage you to have that be a component of the activities that you're doing, is to gather that data so you have it for your geographic location so you can better understand that. There's, of course, also county and state data. So some good sources of that is maybe, county health rankings, the county health department, the state health department, the Centers for Disease Control and Prevention, the Behavioral Risk Factor Surveillance System, or BRFIS, is a really great source for youth and adolescents as well. CDC Wonder is a really great tool that you can filter and look at different geographic areas, different time frames. If you just want to look at a year or maybe the past 10 years, that's a really great tool. The census, American Fact Finder, can also be another really great tool to help you really get at the population that you serve, so you can break it down by maybe the county level or multiple counties or the state that might live within the geographic area that you're saying that you're going to serve. And of course, NCUI, we're always a resource for folks, and encourage you all, if you need any data or if you have any questions or support in that way, please come to us and let us know. If we don't have it, we'll do our best to try to support you in finding it or support you in helping to gather that data potentially too. And moving on to data to demonstrate organizational capacity. Think through existing work in the area. So the length of time, the reach and relationship with the target population, outcomes that you've had, whether it be directly related to this project or it can be something of a similar project that a project that's similar to this that you've done and the impact that had. And existing funders that you've worked with. I think that's always a big piece, especially if it's a new agency that you're applying to. If they understand and see that you have worked with other funders, whether they be federal funders, foundations, that's always really helpful for them, seeing kind of understanding that you're familiar with the process and how it all works, and the reporting, potentially the reporting requirements and all of that. Think about key staff. Think about, I mentioned earlier, kind of combined experience. So maybe you've only been there, maybe the program's only been, or the specific program's only been operating for 3 years, but between the staff, you have a collective experience of over 25 years working on substance use and misuse, for example. Include that in there. It doesn't have to be explicit to the actual project. Key skills and expertise that you have associated with the project as well is critically important. So some grant applications do request resumes or CVs of key people, and so ensuring that you have those. It's all a part of that grant application checklist and responding to those appropriately. And then, of course, existing and new partners. I think right now we're in a time of health systems transformation, and so partnerships are always key. And that, again, usually in the form of MOUs that you might be able to demonstrate, bylaws, letters of support, all really helpful to include. And then finally is the data collection, performance measurements, and evaluation piece. I didn't want to get into this because there are, that was actually the topic of the previous webinar. And so there's some really great resources that Henry Barr just shared on this. So I encourage you to look at those if you're needing support in that. And we can send that PowerPoint slide out with ours as well to build upon that. So with that, I want to turn it over to see if folks have any other questions, comments, improvements to these tools. And ask you all, maybe what are some of the best practices you found? What tools have you used? There are other components of responding to grant applications that, between the previous webinar on evaluation, data collection and evaluation, and then this one kind of breaking down the proposal more into manageable pieces and ensuring that you're appropriately responding to it. And then knowing that the next one is really focused on the budget. Is there another piece of the grant application or responding to funding announcements that might be missing from these three presentations? All right. hearing none, I'll go ahead and just remind you all to just be on the lookout. So we will be sending after probably early next week, and we're going to complete that checklist for folks. I'm going to add, after adding that deadline in there as well. So thanks, Kimberly, for that improvement. You'll get the slideshow, the checklist, resources. So again, if you think of any additional needs that you may have from today's call, or if folks are willing to share their tools and resources that might be of use to others, please feel free to send them our way, and we'll be sure to share those out as well. And then I'm going to turn it over to Sabu to close this out.
Thank you, Jamie, for leading us in part 2 of our behavioral health community learning on how to successfully address a project narrative. And there was a lot of important and useful best practices throughout your presentation. I know that a lot of folks on today took away. And so I would also like to thank everyone who joined and participated. I want to remind you that there will be a part 3, and it will focus on grant budget preparation fundamentals. So if you know of anyone or colleagues or any new staff in your organization that may benefit from our next community learning, please forward your calendar invites to them. We're always supportive of that. And in addition, those who did join, as Jamie had just mentioned, will receive a handout of resources, a PDF of the PowerPoint presentation, and a link to the survey shortly for everyone. So then you could help us better improve community learnings for you. And maybe there's other topics you would like to incorporate or want us to incorporate to address for you. And lastly, if you have any questions or need technical assistance and you're a NUCUI member organization, or you would like to be a NUCUI member organization, please contact me, Dr. Kimberly Fowler, who's the director of our Technical Assistant and Research Center, or Dr. Mark Clark, who's the program manager. And with that note, I would just like to say thank you again for everyone who joined, and we look forward to hearing back from you and seeing you at our part 3 of our community learning.
Thank you, Sabu.
You're welcome. Thank you for sharing.
No, thank you. I'm glad you're still. Hopefully some of these things that we discussed today was really helpful, and let us know what else in the future you'd like us to focus on to better support your organization.
I will. Thank you. This was helpful.
Thank you.
Thank you.
Thank you all.